Cement, a safety meeting video brought to you by weeklysafety.com. Let's get started. Working with cement is part of many construction and maintenance tasks, but it comes with risks that aren't always obvious. This safety meeting covers the health hazards of cement and how to protect yourself on the job. What is cement? Cement is often confused with concrete, but it's actually just one of the ingredients. When mixed with sand, gravel, and water, cement helps bind those materials together to form concrete. Once poured, this mixture hardens through a chemical process that continues over time, increasing in strength as it ages. Cement isn't just used in concrete. It's also a key part of other materials like mortar, grout, plaster, stucco, and terrazzo. That means many different jobs across a work site may involve exposure to cement. Health risks. Anyone working with cement or cement-based products faces serious health hazards if they aren't protected. These can include skin damage, eye irritation, and respiratory problems. Wet cement is especially dangerous because it's highly caustic, absorbs moisture from the skin, and contains abrasive materials. Some cement products also contain trace amounts of hexavalent chromium, which is harmful to both the skin and the respiratory system. Cement burns. Wet cement can cause severe skin injuries known as cement burns. These burns develop because the alkaline compounds in cement break through the skin. If cement is not washed off immediately, it can lead to inflammation, blisters, discoloration, or hardened skin. In serious cases, the damage can reach deep tissue and lead to disfiguring scars or long-term disability. Dry cement might seem safer, but it can still burn the skin if the dust mixes with sweat or damp clothing. These reactions can create a caustic solution without you realizing it. Pain isn't always a warning sign because by the time you feel discomfort, the damage is already done. Anyone with a suspected cement burn should seek medical help right away. Allergies and asthma. Some workers develop allergic reactions to cement over time, even after years without symptoms. Exposure to cement dust can also trigger a respiratory allergy called occupational asthma, which causes wheezing, coughing, and difficulty breathing. These conditions typically get worse if exposure continues and should never be ignored. Breathing hazards. Handling dry cement, especially during bag dumping or cutting concrete, can release harmful dust into the air. Breathing in this dust can irritate the nose, throat, and lungs, sometimes leading to long-term breathing issues. Dust exposure can also damage the eyes, and depending on the level of exposure, effects can range from mild redness to chemical burns or even blindness. When cement dust is present and can't be avoided, proper respiratory protection should be used. Respirators rated P95, N95, or R95 are commonly recommended when dust levels may exceed safe limits. Proper PPE. The best way to stay safe while working with cement is to wear the right protective gear. Gloves should be made of materials like butyl or nitrile, which resist caustic substances. Avoid cotton or leather gloves, and make sure your gloves fit well to prevent cement from getting inside. Tuck sleeves into gloves and consider using glove liners for comfort. Always wash your hands before putting gloves on and after taking them off. Wear waterproof boots that are high enough to stop wet cement from getting inside. Eye protection is also essential. At a minimum, wear safety glasses with side shields or goggles. Avoid wearing contact lenses when working with cement. Additional safety measures. Cement work should always take place in well-ventilated areas, especially when mixing dry materials. If you have to kneel on wet concrete, use a dry board or waterproof knee pads to avoid direct contact with the skin. Be aware that sanding, cutting, or grinding concrete can release crystalline silica dust, which may lead to a disabling lung disease called silicosis after prolonged exposure. To protect yourself, always use proper dust control methods like wet cutting, ventilation, or dust collection systems, and wear a suitable respirator if dust cannot be eliminated. It's important to change out of clothes that are soaked with cement and keep them separate from your clean clothing. If cement gets on your skin, wash it off right away using clean water and soap. Make sure you have access to proper washing facilities nearby. Quick access to water can make a major difference in preventing long-term damage from skin contact. Anyone working with cement who begins to notice skin issues, no matter how minor, should get checked out by a medical professional. Cement-related skin conditions can get worse quickly and may become chronic if it's not treated early. Final notes. Cement is a powerful material, but it comes with serious health risks. So make sure you are protecting your skin, your eyes, and your lungs. Wear the right protective gear and keep the work areas well ventilated. And if you notice any symptoms, speak up and get help right away. That wraps up our safety talk on working with cement. Gear up, clean up, and speak up, because your health comes first.